Heart attacks often strike without warning, but they usually result from a long, hidden process deep inside your body. Clogged arteries don't show symptoms until it's often too late. In the United States, heart disease remains the number one killer, and atherosclerosis, the buildup of plaque inside the arteries, is the main reason behind it. People from the United Kingdom, Canada, and Australia are also heavily affected by this issue, but the numbers in the United States are staggering. Millions live with partially or fully blocked arteries and don't even know it. But there's hope, and that hope starts on your plate. The food choices we make every single day can either push us closer to a heart attack or start cleaning the mess inside our arteries. Most people assume artery cleansing requires medications, surgeries, or extreme diets. But the truth is, real change begins with specific foods that directly impact plaque, cholesterol, inflammation, and blood vessel health. These 12 foods have been shown to fight arterial plaque, reduce blood pressure, and improve circulation. If you're serious about preventing heart disease or trying to reverse early-stage arterial damage, you need to know what to eat every single day. Garlic isn't just a flavor booster. It contains sulfur compounds like allicin that actively lower LDL cholesterol and blood pressure. Researchers in the United States found that regular consumption of raw or aged garlic extract slows the progression of arterial plaque buildup. In some cases, it even reversed it. Studies out of Los Angeles and other regions of California have shown that people taking garlic supplements experienced less arterial calcification, which means their arteries were less stiff and more flexible. That's a big deal, especially when you consider that arterial stiffness is directly tied to sudden cardiac arrest. People in Canada have started incorporating raw garlic into their daily routines, not just for flavor, but for survival. One man in Toronto shared how he lowered his cholesterol by over 40 points in just 3 months by eating 2 raw garlic cloves a day with meals and cutting back on processed food. It burned, but he said it saved his life. The power is real, and it's sitting right in your kitchen. Avocados are often misunderstood because of their fat content, but it's the type of fat that matters. The monounsaturated fats in avocados lower bad cholesterol and increase HDL, the good cholesterol that helps clean your arteries from the inside out. They also contain high levels of potassium, which helps regulate blood pressure. In the United States, where the average adult consumes far too much sodium and far too little potassium, the effect of avocados is even more critical. Potassium helps balance the damage caused by excess sodium and reduces tension in the blood vessel walls. In Austin, Texas, a heart patient who had previously undergone stent placement reported a dramatic drop in his blood pressure after eating half an avocado each day for 6 weeks. His doctor couldn't believe it, but the numbers didn't lie. The creamy green fruit is also rich in antioxidants like lutein, which protect arterial walls from oxidative stress and inflammation, 2 major players in atherosclerosis. Fatty fish like salmon, sardines, and mackerel are some of the best sources of omega-3 fatty acids. These are not just nutrients. They are medicine in food form. Omega-3s lower triglycerides, reduce inflammation, and prevent blood from clotting unnecessarily. That means a reduced risk of stroke, heart attack, and deep vein thrombosis. In the United States, especially in cities with high fast food consumption like Chicago or Houston, people often lack omega-3s in their diet, leading to widespread inflammation and elevated cardiovascular risk. But adding fatty fish even twice a week can drastically change blood profiles. One American woman shared how her triglycerides dropped by over 80 points after just 2 months of eating grilled salmon instead of processed meat at dinner. In Australia, where fish is more commonly consumed, studies show significantly lower rates of heart attacks among older adults. It's not a coincidence. Omega-3s literally make your blood vessels smoother, less sticky, and more elastic. This reduces the risk of plaque sticking and forming dangerous blockages. Berries, especially blueberries, strawberries, and raspberries, are loaded with anthocyanins, a class of antioxidants that protect blood vessels and reduce inflammation. These compounds also help control blood pressure and keep LDL cholesterol from oxidizing, which is one of the first steps in plaque formation. Research done in Boston showed that women who consumed just 3 servings of blueberries and strawberries per week had a 32% lower risk of heart attack. That's massive for such a simple change. In the United Kingdom, nutritionists have been encouraging the consumption of local berries as a cost-effective and natural way to support cardiovascular health. One man in Manchester with a family history of heart disease started eating a berry smoothie every morning with chia seeds, and within 4 months, his HDL rose significantly while his inflammation markers dropped. These fruits aren't just sweet. They're medicinal, and their effects are profound, especially when eaten regularly without added sugar. Olive oil is a staple of the Mediterranean diet, but its impact on arterial health deserves more attention in the American diet. Extra virgin olive oil is full of polyphenols, which are antioxidants that reduce inflammation, improve endothelial function, and prevent LDL cholesterol from oxidizing and sticking to arterial walls. A large study conducted in Spain, but mirrored, in dietary trials in the United States, showed that people who consumed just 1 tablespoon of extra virgin olive oil daily had significantly less arterial stiffness and better heart function. In cities like Los Angeles and New York, doctors have begun recommending cold-pressed olive oil as a replacement for inflammatory oils like soybean or canola oil. One patient shared how switching oils was the only dietary change he made, yet he dropped 15 points in systolic blood pressure in just weeks. That's the power of good fat. It doesn't just replace bad fat, it heals the damage caused by it. Turmeric might be sitting in your spice cabinet, but its active compound curcumin is a powerhouse for your arteries. Curcumin has strong anti-inflammatory effects and helps reduce oxidative stress in the lining of the blood vessels. This is crucial because inflammation is one of the root causes of plaque buildup and artery narrowing. Studies in Canada found that curcumin supplementation reduced arterial thickening in people at high risk of heart disease. In the United States, a clinical trial involving older adults showed that curcumin improved endothelial function, which is a fancy way of saying their blood vessels became more responsive and flexible. A woman in Atlanta, Georgia, began using turmeric lattes with black pepper every morning after reading about its heart benefits. Her C-reactive protein levels, a key marker of inflammation, dropped significantly. And the bonus, she also experienced relief from joint pain, which often goes hand in hand with systemic inflammation. This isn't just about the heart. It's about whole-body healing starting at the vascular level. Nuts like almonds, walnuts, and pistachios are rich in healthy fats, fiber, and plant sterols that lower bad cholesterol and improve arterial function. A study from the United States showed that people who consumed just a handful of walnuts 5 times per week had a significant reduction in total cholesterol and improved flexibility of their blood vessels. Walnuts, in particular, are rich in alpha-linolenic acid, a plant-based omega-3, and studies have shown it reduces arterial inflammation and improves heart rhythm. In Canada, heart health campaigns have promoted mixed nuts as a snack alternative to chips and cookies, with great success. One man in Alberta shared how switching his daily snack from crackers to almonds dropped his cholesterol over 30 points in just 2 months. It's not just theory. These results are happening every day, in real life. Nuts also promote satiety, meaning you're less likely to binge on sugar or fried food later, which keeps your arteries safe from damage. Beets are a natural nitrate powerhouse. When consumed, they convert into nitric oxide in the body, which helps dilate blood vessels, lower blood pressure, and improve circulation. In the United Kingdom, athletes use beet juice before training because it increases blood flow to muscles. But for people with clogged arteries, this benefit becomes life-saving. A clinical study in the United States involving people with hypertension found that drinking just 1 glass of beetroot juice lowered systolic blood pressure by up to 10 millimoles. That's stronger than some medications. A man in Philadelphia said he couldn't believe how much better his energy got after adding roasted beets to his lunch every day. He used to feel tired climbing stairs. Now he said he feels like he's breathing through new lungs. That's nitric oxide at work, opening arteries and helping oxygen move more freely. The red pigment in beets, called betalains, also has antioxidant properties that help prevent LDL cholesterol from turning into hardened plaque. Dark chocolate, but not the sugary kind, contains flavonoids that improve blood flow, reduce inflammation, and lower blood pressure. The key is choosing chocolate that contains at least 70% cacao and no added milk or excessive sugar. A trial conducted in San Diego found that people who ate small portions of dark chocolate daily had more flexible arteries and lower levels of circulating cortisol, a stress hormone that contributes to cardiovascular strain. In Australia, heart patients are being encouraged to choose antioxidant-rich treats like dark chocolate instead of ultra-processed desserts. A woman from Melbourne said she started having 2 squares of dark chocolate in the afternoon instead of cake and noticed her mood, energy, and even blood pressure improved. There's a psychological benefit here too. Feeling deprived leads to binge eating, but allowing yourself a healthy indulgence can keep you on track while giving your body flavonoids that relax the blood vessels and protect the endothelium. Leafy greens like spinach, kale, and arugula are absolutely essential if you're serious about reversing damage in your arteries. These vegetables are high in dietary nitrates, which the body turns into nitric oxide, a molecule that relaxes and expands blood vessels, improving blood flow and lowering blood pressure. In the United States, where diets are loaded with processed foods and sodium, leafy greens are often missing from the plate, and that absence is costing lives. Nitric oxide is crucial because it reduces the stickiness of artery walls, preventing white blood cells and cholesterol from forming plaque. A Harvard study found that people who ate 1 serving of leafy greens per day had a significantly lower risk of cardiovascular events compared to those who rarely ate them. In Canada, public health agencies have been pushing for more greens in school lunches because of their long-term protective effect on vascular health. A father in Michigan said his 12-year-old daughter was borderline hypertensive, and after just 6 weeks of including spinach and kale smoothies into her breakfast routine, her blood pressure dropped into the normal range without a single pill. That's the power of nature's pharmacy. Greens do not just fill your plate, they clean your arteries with every bite. Green tea is another arterial cleanser that is often overlooked in the standard American diet. It's rich in catechins, a type of antioxidant that helps reduce inflammation and prevent cholesterol from oxidizing and sticking to artery walls. The regular consumption of green tea has been linked to lower LDL cholesterol, improved blood flow, and a decreased risk of stroke and heart attack. A study published in the Journal of the American Heart Association found that people who drank green tea regularly had significantly less calcification in their arteries compared to non-tea drinkers. In the United Kingdom, where tea is a common part of daily life, heart disease statistics reflect some of the protective effects, though sugar-laden tea can cancel out the benefits. In California, a woman with a family history of heart attacks began drinking 3 cups of unsweetened green tea a day, and within 2 months, her lipid panel improved dramatically. She said it became part of her self-care ritual, something that didn't just help her arteries, but helped her feel in control. That emotional component can't be overstated. When you feel empowered, your choices change, and your health follows. Tomatoes, whether eaten raw, cooked, or in sauce form, are one of the most effective foods for artery protection due to their lycopene content. Lycopene is a powerful antioxidant that not only reduces bad cholesterol, but also helps strengthen the walls of your arteries and reduce inflammation. In the United States, tomatoes are often consumed in unhealthy forms like ketchup or fast food, sauces packed with sugar, which eliminates their health benefits. But pure, cooked tomatoes or tomato paste actually increase lycopene absorption. Studies from American cardiology centers show that people with higher levels of lycopene in their blood had significantly fewer coronary artery blockages. In Canada, a woman recovering from a mild heart attack began incorporating cooked tomatoes into soups, stews, and salads. Her doctor reported improved artery elasticity and decreased blood pressure within just weeks. The richness of lycopene increases when tomatoes are heated, which makes dishes like tomato soup or stewed tomatoes medicinal for your arteries. Lycopene also reduces oxidative stress inside the endothelial lining of your blood vessels, giving them a smoother, healthier surface. Less friction means less chance for plaque to build. Pomegranates are often called artery cleaners for a reason. They're packed with antioxidants, especially polyphenols, that reduce oxidative stress, improve blood flow, and boost the production of nitric oxide. A groundbreaking study in the United States found that daily consumption of pomegranate juice not only prevented the progression of arterial plaque, but also reversed some of the existing buildup. The researchers found a 30% reduction in plaque thickness after 1 year of daily intake. That's unheard of. In Australia, a man in his 60s shared how his angina episodes reduced significantly after he started drinking 100% pomegranate juice every morning. He went from barely being able to walk a block to hiking up hills again. That kind of change doesn't come from hope. It comes from real biochemistry. Pomegranate's compounds protect your arteries at the cellular level. They keep white blood cells from sticking to artery walls and reduce the oxidation of LDL cholesterol, which is the trigger for plaque formation. They also support the regeneration of the endothelium, the inner lining of the arteries, helping your body undo some of the damage that may have been years in the making. Apples are another simple but powerful food when it comes to cardiovascular health. They contain soluble fiber, especially pectin, which helps lower LDL cholesterol by binding to it in the digestive tract and removing it from the body. They also contain polyphenols, particularly in the skin, that have anti-inflammatory effects on the arteries. A study from Florida State University labeled apples as a miracle fruit, after showing that women who ate apples daily had a 23% decrease in LDL cholesterol and significantly reduced C-reactive protein levels, which signal inflammation. In the United States, where people are surrounded by fast food and sugary snacks, apples offer an easy, portable, and affordable alternative. In Ontario, Canada, a 45-year-old man shared that he started eating 2 apples a day as a snack instead of chips or candy. After 4 months, his cholesterol panel showed major improvements, and his doctor took him off one of his medications. This isn't anecdotal. This is biochemical reality. The fiber in apples binds with cholesterol, the antioxidants prevent oxidation, and the natural fruit sugars don't spike insulin the way processed sweets do. It's simple, effective, and accessible to everyone. Flax seeds are rich in omega-3 fatty acids, especially alpha-linolenic acid, as well as lignans and fiber, all of which contribute to cardiovascular protection. These tiny seeds have an outsized impact on arterial health. They reduce cholesterol, lower blood pressure, and decrease inflammation inside the blood vessels. In clinical studies conducted in the United States, participants who consumed just 30 grams of ground flaxseed daily saw significant reductions in both systolic and diastolic blood pressure. That's better than some medications without the side effects. In the United Kingdom, where awareness around plant-based diets is increasing, flax seeds are now added to smoothies, oatmeal, and baked goods. One woman recovering from a minor stroke began taking flaxseed daily mixed in water, and her blood pressure dropped from 150/90 to 122/78 in just 5 weeks. These seeds must be ground to be effective. Whole flax seeds pass through the body undigested. They're an easy addition to any meal, and their cardiovascular benefits are supported by some of the most respected journals in nutritional medicine. The omega-3s in flax help reduce arterial stiffness, while the lignans block harmful enzymes that promote plaque buildup.